Are you preparing for bariatric surgery, or maybe you just had it recently? What questions are on your mind that you wished you had asked your surgeon? Stay right where you are, because bariatric surgeon Dr. Andre Teixeira is in the house answering your questions.
Looking to change up your vitamin routine? ProCare has a new multivitamin soft chew that comes with 3 delicious fruit flavors. With flexible dosing, you can accommodate your whole family's vitamin needs, and it even includes iron, paired with calcium chews and our new protein powder. Visit ProCareNow.com and use code Susan10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 98. I'm here to help you cut through all the health hype, give you accurate, evidence-based information worthy of the time and all the efforts that you're putting in. Simple, step-by-step strategies that change your life now. I want you to feel well every day. Get out there. Do the things you want to do. This podcast, it's for you. Joining me today is bariatric surgeon Dr. Andre Teixeira. He's a board-certified bariatric physician for Orlando Health Physicians Bariatric and Laparoscopy Center here in Orlando, Florida. And he also works with bariatric dietitian Gail Smith, whom you know, and who joins me regularly on the podcast. In fact, I recently read a journal article in Obesity Surgery written by Dr. Teixeira, Gail, and 2 other professionals on low-calorie sweeteners. You can find all his contact information in the show notes. Welcome to the podcast, Dr. Teixeira.
Thank you for the opportunity to join.
Well, we're so glad you're here. When you see a potential surgery patient for the first time, what are the most common questions that you're asked?
So, there's always the question of, is this the right surgery for me? I mean, should I do this? Am I a candidate for this operation? What are the risks? What are the benefits, right? So the tricky part is, what I tell the patients is, if you are here, that means you've done everything before you try to commit yourself to surgery, meaning the different diets, exercise programs, the new thing, the keto diet, and so forth. And then you also have to bring the patient to reality, meaning look at your BMI, right? Your BMI is 40, right? And that's the difference is our normalcy in the US has changed. Bariatric patients, the population has become larger in America. So our reference point is switching. So that's become also an interesting thing, right? Because some people think a BMI of 40 or 50, you're not candidate for surgery. You are a candidate for surgery for sure.
And, I love what you just said, and that we have to have reality checks. And sometimes I think people think bariatric surgery is the end all be all, and that once that's done, they're done. They don't have to worry about what they eat anymore. They don't have to worry about that. And I think it's often misleading. So I love that you said that you have that you have reality checks with your potential patients. I think that's terrific. So I have a private Facebook group I think I was telling you about, and we have a lot of chatter that goes on in there, and I have questions from my group for you because they know that you're coming on. So I'm going to throw some out to you and let you answer them. So the first one that I got said, you know what? Will I stop losing weight at a certain point and then gain it all back?
Yeah. So this is a very common question, right? What people have to understand is nothing that I do or any bariatric surgeon does is fail-proof, right? Basically, what we're doing is just providing the patient with a tool, right? So you have to take the tool with your lifestyle change and combine both of them. One without the other doesn't work, right? So in the end of the day, you still have to do your part of the game. If you want to have surgery and the only muscle you want to work is the thumb for the remote control, it's only going to work for 3 years, and that's it. If you don't want to change your sweet habits, right, it's not going to work either. And also, which is the tricky part of this, is matching the right procedure with the patient, right? With the right patient.
Speaking on that, I love that. Do you have certain protocol in your mind or as you're talking to them that you're thinking, okay, this procedure is going to fit because of, are there things that you're looking for that help you determine which procedure you're going to choose? Would you share that with us?
Oh, 100%. So one of the biggest things is a lot of people come here and say, I want to have sleeves, right? Because sleeves become the new, or has been the new trend. The
Right.
problem is if you do a sleeve and you're a big sweet eater, carb eater, you're going to regain your weight within 3 years, right? So that's one thing. Second thing, patients with high
And can I
BMIs.
stop you right there? Because I know people are going to go, why? Why? And I think I know what I would think, but I want to hear what you think. Why do you say that?
Yeah, because so if you think about it, right, a bypass, if we eat a lot of sweets and sugar or carbs, you get sick, you have dumping. So then you say, okay, I don't want to do this because I don't feel good.
Right.
With a sleeve, there are very, very, very few people that can have dumping symptoms after they eat sweets on the sleeve. So it's pretty rare. So what happens is you have your regular high protein, low carb lunch, and then midday you say, you know what, I'm going to have a slice of cake. Well, you ate that slice of cake. Now by dinner, you feel, okay, I'm going to have my little bit of my protein. Well, but I already ate more calories than you should, right? So, and it's like the biggest thing is I don't see a ex drug user experimenting drugs again, right? Because they're going to go right back to it. So if you take someone as a sugar addict and you go back to try sugar again, it's going to go back to your old habits.
You know,
So,
Dr. Teixeira, I call those slider foods. You
yeah,
probably heard Gail say that same thing. And it's all those foods that we reach for when life gets tough. Stress equals dessert spelled backwards, and that's what people do. They start reaching for them. And those slider foods never fill us up. They don't give us the restriction we should feel from a surgery. And they're easy just to slide right through and not even be aware of how much the calories or anything. So it is easier, I think, to reach for those slider foods and see that regain that you're talking about.
100%. I mean, you have to look at this as your second chance, right? So, I mean, you have to do your part of the game. So that's why when we look at the patients, I look and make sure what kind of food they eat. I see what medical issues they have, right? Because my goal too is not just the weight loss, guys. Our goal is to get you off most of your medications and get rid of most of your disease, right?
Right.
If someone
I love
comes,
that. Improve your diabetes and lower your blood pressure. Sure. Everything.
Yeah.
It's so great. But what I really like is the fact that you say that you take the time to make sure the fit is right. It's like nutrition. It used to be everybody did one thing. And now we know genetically and everything else, nutrition is very personalized and you want it to work. And a bariatric nutrition plan is very personalized. It has to be a certain way. And I love that you're looking for the surgery procedure that's going to be the best fit for your patient, not just okay, here we go. I think that's
100%.
That's terrific. Okay. So next question. The question is, I feel like I'm a slow loser. How much weight is average loss post-surgery?
So that's a great question, right? We get asked that question all the time, right? There is really not a true number, right? You have to look at it. There are some patients that respond what we used to call a slide curve of weight. So weight with time, right? So you slowly lose. It just takes longer to get what you want to be, right? So that's one thing. Two, there's some people that it's called the rapid losers. They look just big slump down and then they plateau faster, right? Well, I don't like that because patients think they're going to be losing nonstop forever, right? And then you have what's called the stairway, right? So you lose, plateau, right? I like that because it gives time for the patient to make their change activity-wise, make their modifications slowly, right? So I think sometimes that in the psyche of the patient is better.
And it's
Second,
interesting that you say that, because yesterday we had someone post in the group and they said, I have a question. What is a plateau and have I reached it? And they said, I had my surgery a couple of months ago. I've lost. Now I've stopped. And I don't know if I should up my exercise or up my protein, but explain to me what a plateau was. And so I think what you're saying is a great way to help them understand that, because this is obviously very common.
correct. So the plateau is always a part of your body say, hey, what's going on here? Why am I losing weight? I mean, it just kind of sort of regulating itself. So the way to trick, like you said, you add more protein, you eat some things around, change a little bit your diet for a week or so. A big thing to jumpstart is, let's say, if you used to train, exercise every morning, for a week you do in the evening, and then you go back in the morning. So it kind of tricks your body and you start losing again. So plateaus are always normal, right?
Good. I'm so glad that you shared that. Okay, next question. What is the percent success keeping the lost weight, is there what they mean, after a sleeve on long term, 5 to 10 years down the road?
Great question, right? So we don't look at percent success, right? We look at the failure rate, right? So when you look at the failure rate, so the problem is there's really not truly holy grail definition of failure rate. Failure rate can be losing less than 50% of estimated weight body, right? Losing less than 12% of total body weight, not getting off your insulin, not getting rid of diabetes. So there's so many different definitions, right? But the most common definition is not losing more than 50% of your estimated weight loss, right? So that's a number that was given, right? The question is, if you could take someone that loses 200 pounds and that's like 30%, I mean, you still lost 200 pounds, which
Absolutely.
is a great number, right?
Yeah, you bet.
Yeah, so for me, success is in the eye of the beholder, right? So you could have lost 10%, but got rid of all your medical issues. So the surgery worked for you more on a metabolic perspective. That's still going to make you live longer, right? Then more of a weight perspective. Of course, those are rare, right? Those are rare because most of the time they come together, weight and we get rid of the medications. But if you take, for example, sleeves, sleeve has about a 25 to 28% failure rate, right? Long term. Okay. Granted, if you add that on patient as a sugar eater, a carb eater that got the wrong operation, then the chance of them going back to their weight regain is pretty high.
Right. So again, wrong operation. I like that you just said that. Wrong choice for them.
Yeah. Same thing with a sleeve when a BMI greater than 50. Unless if you're planning to do a two-step operation, then which is a sleeve and then a switch, a sleeve with a BMI greater than 50, they have less than 5%, have a BMI less than 30.
And I like where you said it's in the eyes of the beholder, because for some people it's about weight loss, but some people it's about getting their health in better shape. For some it's about
Correct.
both. So the eyes of your success is really how you feel about it and what you think. I like that. So then there's just the standard question you probably get asked all the time, and it's a broad one. How much weight will I lose?
That's a good question too, right? So there's no way for me or anybody to predict, right, how much weight you're going to lose. We can give you what's called an ideal body weight, right? We can calculate that. But that doesn't take in a lot of things into consideration. It doesn't take how old you are, doesn't take where you come from, genetics, doesn't take how many kids you had, if you're a woman and so forth. So it doesn't take a lot of things in that perspective, right? So, and it also doesn't take a lot of your medical issues, like if you're a bad heart patient, pulmonary patient, all that kind of hinders, right? When we come, so what I do a little bit different. We do a little bit different in our practice. We said, I'll give you a deal by the weight, but knowing that is not the perfect number, right? And then we set short-term goals, right? Because for me to make you lose, say I want you to lose 150 pounds in 12 months, that's a very long goal.
Plus, it's overwhelming. I mean, it's overwhelming.
Exactly.
You hear that and you're like, really? Are you kidding me?
Exactly.
Let's just try tomorrow, and the next day, next week.
Exactly.
Okay.
So we
Go
make it
ahead. Yeah.
short goals. That's all. We just make short goals like every 2 months, and so forth, and just we help the
Plus,
patient up that way.
you see changes every 2 months, and a lot of times you have to kind of reevaluate where they are and what they need next and what they need to tweak, just like the plateau that we were just talking about a little bit ago.
100%.
So this fits with the next question. I am 2 years post-op, and I have not lost as much weight as I would like. I'm not at 100 pounds yet. No gains, though. Will this change?
So good question, right? Depends on what surgery they had, right? Also, going back to the reality check, right? So some patients come to us, you're 50 years old, let's just put a number, right? And they show a picture when they were 19, right? It's going to be very difficult for you to go back to that weight, right? So you have to be realistic, and your expectation has to be real, right?
Mm-hmm.
And there are some patients that we will require to have plastic surgery to be able to lose more weight, because sometimes of the excess skin is so much, they hinders them the level of activity to go higher, right?
Sure, makes
Sweats,
sense.
rash. So all that comes into play.
So this is a question I want to ask that I'm just thinking, how often do you do revisions? Is that common? More common than you would like it to be? Or tell us about revisions and explain what revisions are.
Yeah. So revisions are, you can convert, there are two ways, right? Revisions and conversions, right? So revisions, if someone has a weight regain, we can revise their bypass. We can convert the sleeve to a bypass, or sleeve to DS, or bypass to DS. So usually those are for weight, right? Gain, right? But it also has revisions for complications like ulcers, perforations, and so forth, right? Which is a different animal.
Right.
Here we're talking about for weight. So it depends on how you develop your practice, right? So my practice here is pretty known for revisions and complex work too, right? So we do the primary work, of course, but also we do revisions almost every week, because we have people flying in from different areas, right, just to have surgery by us, because we do so much, especially duodenal switches, right? We're really expert on that. And we convert a lot of bypasses to switches and so forth, so which is a very large operation. But if you think about it, you put in an average about 200,000 surgeries done a year, right, in the United States. I mean, you're going to have a percentage of revision of this, right? If it is 10%, which is 20,000, right? So I'm not so sure if it is that high, right? We don't have that number of revisions nationally, but depends on kind of side your practice. My practice, I see it every week, right? Sometimes I feel like I'm just have
Sure, makes
sometimes
sense.
I think I have a revision practice, but that's okay. I like what I do.
So as we wrap up, what takeaways do you want to leave us with that you always want your patients to know or to think about?
Great opportunity. So I think that a patient should understand, because your friend or your family member had operation X, it does not mean that's the best operation for you, right? You need to understand and listen to the surgeon that's talking to you, and give you the reasons why he thinks this is the best operation for you. Most surgeons that I know tend to look for the operations that will give you best benefit for you long term. We really don't care about the 3 years, right, or 4 years outcome. I mean, we care, but we care more is that you're not going to come back for weight regain because you went back to your habits. Make sense?
Makes sense.
It is important that you understand that when you leave the practice and you're comfortable, if I say, hey, listen, you should have a switch because of this and this and this, and then you go home, you look at Facebook, you look at Google, you look to your friends, and decide to do something else because of that. And then you're going to regret, because it's going to be more difficult for you to get revisions nowadays. So a lot of insurers are not covering those anymore. So you have to be careful.
Well, you heard it right here. This is very personalized. The surgery that you have is very specific to you, your disease state, your other health issues, and your needs. Thank you, Dr. Teixeira. That's really a lot of great information. I so appreciate that you took time away from a super busy surgery schedule to not just be available, but to answer all of these questions. I know that my listeners appreciate you.
Thank you so much for the opportunity. Anytime I'm available for you guys.
You're welcome. Well, don't forget, if you're not receiving the weekly Breaking Down Nutrition newsletter, you can sign up for it right now on the homepage of my website, breakingdownnutrition.com. You'll be the first to hear about the podcast episodes, tips, recipes, new products, whatever it is. I'm all about your success because you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.